Labral tear and pelvic floor dysfunction is the subject of this video. In this video, I'll tell you more about what labral tear is, how it is related to pelvic floor dysfunction, and what the solution is. Is it surgery or is it more? So let's talk about labral tear. Labral tear is a tear inside a ball and socket joint. You can have it in your hip joint, which means that the ball and socket joint where your leg gets connected to the pelvis is not functioning properly. So if this is the ball coming from the lower extremity and this is the socket coming from the pelvis, there is dysfunctional patterns of movement leading to lack of centralization of this ball inside the socket, leading to scraping of the cartilage, causing labral tear. So when I hear someone has labral tear, I know that individual has pelvic floor dysfunction because the pelvis is not stable. So now, let me explain to you how that works. Most people think pelvic floor dysfunction has to do with incontinence. While incontinence is one of many chapters of this book called Pelvic Floor Dysfunction, pelvic floor dysfunction comes in many shapes and forms in so many different ways. The muscles inside of your pelvis work with the muscles outside of your body, of the pelvis, to stabilize the pelvis. The pelvis is the foundation to the structures above, and without a strong foundation, the health and safety of the structures above is compromised. That's why you have double layering of the walls of the pelvis, and you have some big, strong muscles to support it. Now, when the stability of this is compromised, in case of labral tear, for example, when the socket's integrity, the positional integrity of the socket or the pelvis is compromised, then the socket can fall in onto the ball, and every time you move your legs in walking, something very simple, you're damaging the joint. When there is lack of stability, there is pelvic floor dysfunction because the muscles on the inside modify their presence and their function to try to stabilize the pelvis. That by itself means tension of the muscles inside, and tension leads to not just tense muscles, but weakness as a result of tension. Kind of like when you're tired and you're overworked, you get weak and you don't want to move. You lack energy. So pelvic floor dysfunction and labral tear are both signs of dysfunctional patterns of movement, which is what the fix is. The fix is to make those dysfunctional patterns of movement into functional patterns of movement. So then the question is, why do they become dysfunctional? They become dysfunctional as a result of many things. It can be injuries, it can be lifestyle. Imagine how much sitting we're doing. It could be playing sports, one-sided sports. Could be so many different things that initiate the process, and then we end up with signs and symptoms and aches and pains that we go to providers, or we maybe look it up on YouTube, and then we are wondering, well, what is causing this? And then we go after, let's say, back pain. We go after the lack of hip mobility, and we think some exercise is going to magically make it go away. The reality is, isolating a body part to try to exercise it never materializes long term. Instead, when you work on exercising, definition of exercise being working on something that you're not good at, then when you exercise mechanics of movement, the blueprint of movement, then you will have a much better end result. So then the question is, how do we know what the mechanics of movement is? Well, by studying human babies, knowing that all babies on this planet go from helpless infants to become running toddlers without any bands or weights or guidance or anything, it's very common and common sense to realize that this is all hardwired with us, in us. And we all go through different stages of movement, one before the next. Because while we're working on building mechanics and fine tuning it and really getting it as a part of our profile, until then, we are not ready to go to the next part. So when we study human babies, we understand what those systems that need to be in place are. And then when I start working with my patients with pelvic floor dysfunction, with labral tear as an example, I use those understandings to try to kind of like that's a blueprint of movement, to try to see where the patient is, what they need to be doing, and most importantly, for the patient to understand what right looks like. Because once you understand that, that's kind of like learning how to read. Once you understand how to read, you can read any book for as long as you want to. And that is so, so important. Ownership of understanding what needs to be in place is a responsibility of every single one of us, not just the provider magically snapping their finger for the problem to go away. I hope this makes sense. If you have not subscribed to the channel, please make sure you do. Make sure you share it with someone whom may have issues with pelvic floor dysfunction or hip issues. And until next time, take care.